Brooklyn Independent Television.
Hello and welcome to Brooklyn Elected Officials. I'm Dr. Mathieu Eugene. Today I'm joined by Dr. Paul Saunders from the Cardiothoracic Division at Maimonidies Medical Center. Doc, thank you so much.
Oh, thanks for having me.
Thank you for coming. You know, I'm very grateful to you. And on behalf of the community and also on my own behalf, I thank you. Because I know, doctor, from cardiology, you are so busy taking care of the patient, and you take time, you know, from your busy schedule to come here. This is remarkable. Thank you so much.
Sure.
And I know today we are going to talk about heart failure.
Mm-hmm.
This is a very, very serious disease. It is very important for the people to know about this so important disease. But before we start, would you please say some few words about yourself?
Sure. Well, my name is Dr. Paul Saunders. I'm a heart surgeon. I'm originally from New York, grew up in Manhattan. My mother's from Brooklyn. I did all my surgery training in New York at NYU, and then I've been in practice at Westchester Medical Center for the last 5 years. And I was just recruited to come to Maimonides in the last about 8 months ago to help start up our surgical heart failure program and ventricular assist device program.
You know, we're going to talk about heart. Heart is such an important organ.
Mm-hmm.
And I'm grateful to you for coming to talk about this very important organ. And before we start talking about heart failure, would you please say some few words about the importance of the heart? Because we know that the heart is a pump that pump the blood out to all the organs that receive the blood and pump it out also.
Sure.
But just for the people to understand what you're going to discuss, would you like to say some few words about the heart, please?
The heart, I mean, I'm a little biased, but the heart is just about the most important organ in the body. It pumps the blood to the rest of the body. So obviously it's very vital. Has a number of different structures within the heart which can require medical treatment or surgical treatment. Some of the things that we as heart surgeons take care of is blockages in the coronary arteries, which requires either stenting or bypass grafting and bypass surgery. Also valvular problems such as the aortic valve stenosis or mitral valve problems, which can require, again, medical treatment or heart surgery to fix those things. So obviously, yes, as you said, the heart is a very important organ in the body, and it affects people's health in a significant way.
Yes, thank you very much. But I know you go so fast, let's try to put it. You know, people who are not in the medical field, they don't used to see the heart, and probably they may not understand the heart. So you say that the heart pump the blood out,
right?
But the blood come to the heart also, right?
So blood is blood's returned from the body to the heart, to the right side of the heart.
Okay.
The right side of the heart then it pumps the blood to the lungs. The lungs then give the blood oxygen and then returns the blood back to the left side of the heart. The left side of the heart, which is the strongest part of the heart, then pumps the blood to the rest of the body. And it can react in terms of the patient's own needs. If you're exercising, the heart can pump faster. If you're more sedentary, the heart is going to pump slower, but the heart can adapt to the body's own needs and pumps the blood based on what the patient needs.
There are two very important things that you just mentioned. You say that the blood, you know, go to the heart also, arrive to the heart also on the right side, and then leave the heart from the left side.
Correct.
And go to the lung first and go to the left side. So that means we have two different blood in the heart.
You have on the right side you have blood without oxygen. So blood is being returned from the body, which is deprived of oxygen because your body's used up all the oxygen. And then on the left side of the heart, because the blood's just come from the lungs, the blood now has oxygen in it. So the blood is then ready to pump that oxygenated blood back to the rest of the body.
So that means the blood get back to the heart, you know, to the right side, and go to the lung, and go to the left side, and leave the left side to go to everywhere in the body.
Exactly.
This is very interesting. God is a genius.
Absolutely. Absolutely.
Very important. And another thing that I want to remind our viewers, that means the left side pump the blood out.
Correct.
Okay, very good. But I know that the heart is such an important organ that usually they talk about left heart failure, right heart failure. So could you mention, you know?
Well, sure. As the heart can be affected by various different conditions, which can reduce its effectiveness to pump, and we call that heart failure.
Okay.
Heart failure, essentially, in layman's terms, is when the heart can't pump blood efficiently as it needs to. And that can affect the right side of the heart, the left side of the heart, or both. And patients who are experiencing heart failure may experience such symptoms as fluid retention and swelling of the legs. They may get fatigue and unable to exert themselves as they normally do, or unable to walk more than a few blocks or walk upstairs. They may get shortness of breath. They may be unable to catch their breath when they're exerting themselves or when they're just sitting comfortably. And they may develop fluid retention in the lungs. So any and all of these symptoms can be related to heart failure, whether it's left-sided or right-sided heart failure. And that's can become a very significant problem for a lot of people.
You know, Doc, I don't want you to go to the detail, but I know that knowledge is power.
Sure.
And more knowledgeable people are about the heart or the health condition, better they're going to be able to take care of themselves. I don't want you to go to the detail, but because I see people usually say, oh, I got a swelling in my foot, I got edema. You're talking about my heart. What are you talking about? You know, my heart is okay. I just have a swelling in my foot. Can you just quickly, you know, explain why somebody could have edema or swelling in the foot because of the heart condition?
Well, sure.
I just want the people to understand that.
As the heart, you know, essentially it's a pump that gets backed up, just like if you have a pipe that gets backed up. If the heart can't pump the blood around the body as efficiently, that blood's going to back up downstream, and it tends to back up towards the rest of your body, and the legs being, because they're dependent and the fluid is sitting down in your legs all day, the heart is, you know, cannot continue to keep up with that demand, and the blood starts to backs up in the feet, which causes swelling. It backs up in the lungs, which can cause fluid and water to build up in the lungs. So these are all things that can be all affected by the heart, even though they seem far away. It's all affected by the heart because the heart's the central pump that keeps all that fluid going throughout the body.
And you're talking about difficulty to, you know, difficulty to breathe also. What is the correlation with that?
Well, it can be from fluid in the lungs. It can also be from, as the heart's less efficient, it can't oxygenate the blood as quickly, so your blood oxygen level goes down. So you can't catch your breath. You can't get enough oxygenated blood to the rest of your body. And so that people feel that by being unable to catch their breath and having shortness of breath.
Very important, very important. But in terms of the heart failure, are there other diseases that are connected or that have certain relation with the heart disease, the heart failure?
Sure.
Well, the disease.
Heart failure there's many reasons that you can get heart failure. So some of the things that are most common, things like hypertension. Hypertension untreated over time can cause heart failure. Also linked with that is coronary artery disease. So if you have blockages in the vessels that provide the blood flow to the heart muscle itself, over time that can cause heart failure. Other types of valvular problems. So if you have a disease of the mitral aortic valve, that can cause the heart pump to not pump as efficiently. There can be also other causes sort of out of the blue, which can happen without those different diseases, but they can cause heart function to fail on its own, or other types of viruses or other things that can affect the heart. So there's many causes for heart failure, and those can be figured out through different diagnostic tests, but there's many causes, but they all can lead to the same central pathway, which is an inability of the heart to function well.
Very good. You know, I said that before, you know that, and we all know that knowledge is power. And the people, our viewers, they don't have the opportunity to have an expert in cardiology to come to give information like that. You mentioned valve. Could you explain to our viewers what is the valve? What is the function of the valve? Why somebody can have, you know, a heart failure because of the malfunction of the valve?
Sure. Okay.
Could you please?
The valves
not in detail, but you know.
Valves function just like a valve in a pipe. And the valves restrict the blood flow to make sure that the blood flow goes only one direction. When the valve gets leaky, it can cause blood to leak backwards and puts additional stress on the heart because the chamber has more blood than it's supposed to have. It forces the heart to work harder, and over time it can't keep up with that, so it starts to fail. The valves can also be too tight. and can cause the heart to have to work harder to make the blood go the right direction. So again, over time, as the heart tries to compensate for this, the heart can start to fail because it can't keep up with the extra work that it has to do. So these valves are basically just simple valves that prevent the blood from going backwards. But if they have problems with the valves, they can cause heart failure.
Doc, there's something that crossed my mind right now, because I want you to talk about that, because you know, throat infection. You know, some of the time that people get infection in the throat and they don't take care of it.
Sure.
You know, that can be very bad for the heart, and you know, I'm talking about rheumatic fever.
Rheumatic fever, sure.
Yes, people don't understand that. I got a throat infection, that's okay. They don't take it. Could you please stress the importance of treating the heart, you know, the throat infection,
sure,
to prevent heart disease, because you know, the consequences are so serious.
Sure. Well, yeah, different types of infections, as you said, throat infections, strep infections, can lead to what's known as rheumatic fever. Rheumatic fever can be essentially from a very simple, uncomplicated infection, can develop an infection on the heart, which can then set up scarring and damage to the heart muscle and the heart valves that over many years can cause significant problems with the heart valves. Luckily, we don't see that as often in this country, but we see it very frequently in patients from other countries around the world. And especially in Brooklyn, our population, we see patients from all around the world, so we actually see the problems associated with rheumatic fever quite frequently. And it can happen not necessarily soon after the infection, but many years down the line, in 20 or 30 years after the infections have happened, and it causes significant problems with the heart.
Now, heart failure, but what can be done? I know that you're going to talk about a very state-of-the-art device. But before we get there, what can be done when somebody gets heart failure? Well, and I want you to talk about the new device, because I don't want us to get to the time, out of time.
Sure.
And, yes.
Well, there's lots of, obviously prevention is very important, and taking care of watching your blood pressure, watching your cholesterol, watching your diet, avoiding smoking, all those types of things will lower the overall risk of heart disease. For patients who have true heart failure, where the ejection fraction is low and the heart function cannot keep up with the demands of the body, there's lots of different things we can do. Starting off is medical treatment with different medicines to lower the blood pressure, to help to improve the heart's ability to pump. All these things we can do, which can help patients a lot. But for patients who are still suffering significantly from heart failure, where medicines are not enough, we have different surgeries we can do to help either restore blood flow or fix valve disease. But even if those things don't work, then we're left with not that many options for most patients. For patients with profound heart failure, heart transplant is really the best treatment. Heart transplant is still the gold standard treatment for people with severe heart failure, who will not live long because their heart function is so poor. Unfortunately, heart transplant is not available for everybody. The number of heart transplants in the whole world is under 5,000 every year. So there's very, very few heart transplants done in relation to the number of patients with heart failure. And that's because there's just a shortage of people donating their own hearts to be given. So this number has not really changed significantly over the last few years. So that treatment, while it's the best treatment, is not available for as many people who need it. And that's why there's some new exciting treatments that are available throughout the world, and more specifically now available in Brooklyn for patients with end-stage severe heart failure who can't get a transplant for whatever reason, or can't wait for their transplant. And that's things called ventricular assist devices, or VADs, specifically left ventricular assist devices. We're talking about these devices are essentially pumps that help to augment the pump function of the left heart. So as we said, the left heart pumps blood to the rest of the body. These pumps work next to the left heart to basically give a jump start and give an additional amount of pumping power to the left heart. And the device that I happen to have here which is called the HeartMate 2. This is a new state-of-the-art, fully implantable pump that takes blood from the left heart and pumps it back to the patient's own body. It's fully implanted, so this whole device actually sits inside the patient's body. The only connection that actually leaves the body is a small tube that carries the power and the electrical signaling for the pump. And that that part leaves the patient. The patient's then connected to a small power pack and to batteries, and then can basically resume their normal function. So this device is designed to help people who are dying of end-stage heart failure, whose life expectancy is reduced, who can't do their normal activities, who can't leave their house, can't leave their beds, who are maybe stuck in a hospital on lots of very intensive medications for heart failure. With this device and with this surgery, we can allow the patients to leave the hospital, to go back home, to resume their lives, to go back with their families, to do essentially the normal things that they were doing before, without being burdened by heart failure.
This is remarkable. That means, this allows the person to get back to almost a normal life.
Exactly. With very few restrictions, patients can really resume their normal lives. They can drive, they can travel, they can spend time with their families, they can be free to leave their house, as much as they want to, without worrying about shortness of breath or inability to walk. So we're excited at Maimonides to be able to have this technology now. We have recently started a comprehensive heart failure program with myself, Dr. Greg Crook, one of my partners in surgery, Dr. Norbert Moskowitz, one of our cardiologists. We have a comprehensive heart failure team based of cardiologists and cardiac surgeons who work with patients to give them the medical therapy or the surgical therapy they may need. And we're excited that we've actually successfully done our first implantation of this device in a patient from Brooklyn just a few weeks ago who's doing very well. So it's a very exciting thing for us at Maimonides, an exciting thing for the people of Brooklyn to actually have this technology available in Brooklyn. As we know, patients who have these pumps are very sick. They require a lot of medical care. And in the past, they've had no other options except to go into Manhattan, travel great distances to get their treatment. Now we can actually offer this treatment much closer to home, in contact with all their regular doctors in their borough where they come from.
I'm so happy to see that we have this technology available right here in Brooklyn. And I want to commend all those people from Maimonides. I know the great job that they are doing, and I want to commend you also, because it does make a difference when people in Brooklyn can stay in Brooklyn to have state-of-the-art medicine service, treatment for the medical situation. It does make a difference.
Absolutely.
And that's the reason, honestly, I want to tell you that as an elected official, I'm advocating all the time for the hospital in Brooklyn. I advocate for all the hospital, of course, but I do everything that I can to make sure that our hospital in Brooklyn have the resources that they need to provide the services to the people in Brooklyn. That does make a difference. And I commend you for that. Let me ask you one thing, Doc, because many of us, we didn't know about this device, and I'm sure that many of our viewers, they may be suffering from heart failure, they may probably be in need of such assistance. If they want to have more information about this technology, what is your phone number? I think I can contact you or contact Maimonides Hospital.
Well, they can reach us through our website at Maimonidesmed.org. We're easily found on the internet, and all the information about our program is there. But also we have a special number just for the heart failure program, which is 718-283-5CHF. So 5 and then the letters CHF. And they can reach us through our office there. They can reach me. They can reach my partners. They can ask questions. They can find out anything else they need to know about heart failure, about our treatments, and what we can do to help patients.
But let me ask you one thing also. Is it easy for the patient to control or to manage this device, or is there any training that is necessary?
So the patients, there's some things the patients need to learn. We find that patients actually pick it up very quickly. If you can change the batteries in a flashlight, you can pretty much change the batteries on this. It does require that the patients and the family are willing to make this change in their life, but most patients find that they feel so much better, and they're able to resume their lives and live longer. They're willing to make the small sacrifice, to undergo this surgery and undergo this treatment. And that's what we found with patients over the years, that they're so happy they can return to their lives. And as you know, the most famous patient who's gotten this device is the former Vice President, Dick Cheney, who underwent implantation of this same device about 2 years ago because he had been suffering from heart failure for quite a long time. He had this device put in for about 2 years. He just had it recently taken out when he had his heart transplant. So he's now living with a heart transplant, but he was a successful patient who was helped by this device and these types of devices.
But in case the patient cannot receive a heart transplant, how long that the device can be helpful or useful?
Well, this device currently has been used to help patients for up to 8 years.
8 years,
so it's quite a long time, considering that most
patients,
the patients that we're talking about who are getting this device will probably not live more than a year without some sort of treatment.
6-7 years of difference. That's
huge.
That's huge.
Absolutely. And we know that from lots of research that patients who are in end-stage heart failure, if they're treated with medicine alone, most of those patients will not live more than 2 years. Whereas with assist devices, about 70% of them can live up to 2 years. So you're talking about a huge difference in the outcomes. And not only will they live longer, but they'll feel better, be able to stay out of the hospital more frequently, and be able to resume their normal activities much more easily.
Very good, very good. So that means if the patient is in need of this device, the person can go to Maimonides and you do the screening and see what is if the person is a good candidate for that and
Absolutely.
stuff like that.
There is an intensive screening process for it, obviously, but everything can be done at Maimonides. We screen the patients, we can treat the patients. If they need the surgery, we can provide the surgery, and we take care of them for the rest of their lives.
Great, wonderful. Doc, I'm going to go back, to
Sure.
one or two more questions, because you said at the very beginning, and we know that heart is a very important organ, but the heart pumps the blood out and receives the blood. But does the heart receive blood also, or need blood also to function?
Sure.
Because I remember you talk about coronary,
Sure.
Arteries, and
the heart's a muscle like any other muscle in your body, and muscles need blood flow and oxygen to pump and to work effectively. So the heart is no different. The heart gets its own special blood supply that supplies the heart muscle from the coronary arteries, and these are arteries that deliver the blood with the most oxygen in the entire body directly to the heart muscle itself. And that's important because over time, based on some of the diseases we mentioned before, these arteries can become blocked. Blocked by calcium, blocked by plaque, by atherosclerosis. And that's affected by things like high blood pressure, hypertension, by smoking, by diet and cholesterol. Any of those factors can affect the blockage of those arteries. As those arteries get blocked, the heart muscle gets deprived of blood flow and oxygen. And when that happens, the patients can have a heart attack or can have chest pain related to exertion. When these type of symptoms come up, patients really need to be seen by doctors and by their cardiologists right away to get evaluated, because they may need very specific treatment to treat these blocked arteries, whether they need to be opened with stenting or need to have surgery. But this is a serious life-threatening problem.
Doc, what type of advice you could give to our viewers in case they have certain symptoms, of heart disease? Let's say, for example, I know that some of the people, when it's snowing, they want to shovel the snow,
sure.
and also the men, especially, they believe that they are Superman. They want to do everything, especially at a certain age, and heart disease patient. Is that can increase the risk of a heart attack or heart disease, or make the heart condition worse? If somebody in the snow trying to shovel the snow.
Sure.
And
well, snow shoveling is something that actually puts the heart under a lot of strain, because shoveling snow, most of the time, it's a very, very intense, vigorous aerobic activity, and most people are not used to that type of activity quite that frequently. So people will go out and shovel snow, and it seems like it's not that much of an activity, but it's an incredible strain on your body and specifically on your heart. So it's very frequent that their first knowledge of their own heart problems is after shoveling snow, because it puts the heart under such tremendous stress that we find out that they may have problems with the coronary arteries. But anybody who has symptoms of pain or tightness or squeezing in the chest, or that pain that may go to their jaw or down their left arm or their shoulders, or may have shortness of breath with walking or with exertion or with any heavy strenuous exercise, those are serious symptoms that should not be ignored, People should, if they're experiencing chest pain, either should call 911 or go to the emergency room or see their family doctor or their cardiologist to have those symptoms evaluated, because those symptoms can progress to become very significant medical problems and become life-threatening.
And what other advice you could give to the heart patient in terms of lifestyle and smoking, alcohol, or diet?
Sure.
Is there anything that?
I mean, we stress to people to exercise moderation, to follow a healthy diet in moderation, to again use alcohol in moderation, to avoid smoking, because smoking is a direct toxin to the blood vessels. So smoking is something that we absolutely counsel everyone to stop. Smoking will certainly increase your risk of heart disease. And to follow up with your regular doctors and keep up with your checkups, take the medications as prescribed for you, be aware of high blood pressure, because it's a very significant medical problem for our community especially, but for everyone, and to be aware of symptoms as they occur and report symptoms to your doctor, and don't just ignore them and let them pass.
Very good. Doc, I cannot thank you enough. Thank you so much. Those information, they are vital, they are very important for our viewers, even for each one of us, because as we said at the very beginning, heart is such an important organ, and we have to take care of our heart. The viewers and everyone should take care of his heart, because as I usually said, and you know that preventive medicine is the best medicine. It's cheaper and people don't suffer, and I think you are doing a great job. Thank you so much for providing such important information to our viewers and to the people in Brooklyn. And I think also Maimonides is one of the big assets for us in Brooklyn. We are out of time, Doc, and I thank you very much, and I think that you will get back again. That's all the time that we have for today. Thank you for being here, Dr. Saunders, and I'm Councilmember Dr. Mathieu Eugene. Thank you for watching Brooklyn Elected Official on the BCAT TV network.
Watch this and other Brooklyn Independent Television episodes online at breakartsmedia.org/BIT.